Hello, everybody. I just wanted to let you know that you are in the right place, and we are just letting people log on, and we will get started right at about 11 a.m. in about 2 minutes. So just heads up, you're here, you're in the right place, and thanks for joining us, and we'll be with you shortly. Okay, it's 11 o'clock, so I think we're going to get started. I see a lot of people have already logged on. I just want to take a minute to introduce myself. My name is Marianne Clerkin, and I'm the Marketing Communications Director here at Threshold Security. Just let me start with a little housekeeping, if you don't mind. Everybody should be on mute, except for Bill and I. And if you have any questions, there is a question button that you can use. There's also a raise your hand button that you can use. And we have someone monitoring those things. So please feel free to use those if you're having a problem or if you just want to ask a question or have a comment. So that's all there for you to use. So please do so. And we are planning on trying to wrap this up in about 40 minutes, 45 minutes. So just thank you again for joining us. And we'll be letting you download the presentation at the end if you'd like, or we can send it to you via email. And we also have some articles from Bill in our handout section that you'll be able to download as well. So please take advantage of that if that's of interest to you. So just in case you don't know who Threshold is, we are a manufacturer of visitor management systems. We're most well known for our expiring badges. But we're very committed to the IHSS and to supporting healthcare security professionals like yourselves, and we're proud to sponsor this event today. Today's conversation with Bill will be one of 3 that we'll be doing, and I have a slide at the end that will tell you a little bit more about the next 2 events that we have coming up, and we will be emailing you about those events when the time gets closer. So that's more to come. I am very honored to have Bill here today, and he's going to be speaking about workplace violence and the new regulations from the Joint Commission. For those of you who don't know Bill, he's got 40 years in the healthcare industry, 30 years in healthcare security specifically. He's very well versed in healthcare and workplace violence. You can see from this slide how many incidents he has been involved with. So he's got a lot of expertise to share with us today. Bill is also an attorney and currently owns his own business, security consulting business called Strategic Security Management Consulting. So thanks for being with us here today, Bill. Did you want to add anything to what I started with, Bill?
No, I just want to thank you for allowing me to this opportunity to present, and thank everybody for being online here. So that's a great picture. That's me with hair.
That's great.
1983, I started off as a security officer in a hospital, and you know, kind of interesting backstory. What I didn't know when that picture was taken was what was going to happen during the next 40 years or so. And you know, I was looking at my operations boots on the ground career, and you know, as a guy running around the hospital, and I estimate maybe I probably was involved in about 5,000 violent encounters, and not everything rose to the level of a knockdown, drag out overall, but maybe just restraining patients and things like that. And as a leader in a very large healthcare system, we estimated probably more than 70,000 incidents of violence that occurred. Is the way we kind of figured it out. During that time, 1,000 lockdowns, and not full hospital lockdowns. We're locking down the emergency room or individual department. Interestingly, a lot of threats that we investigated. So I know a lot of folks online here are do a lot of threat assessments, so they'll kind of track on that. And we're a large healthcare system, so we investigated quite a bit. And I says I disarmed patients with the knives. I survived 2 attacks, but from patients as a result. So one thing that I'll add to this that's not on the slide is, when I was in law school, I was toward the end of my first year of law school, and I was working full time as a security supervisor at the time. And I went to the aid of a security officer in our holding area in the emergency room. There was only one security officer and myself on duty, and we were running short that day. And I was on light duty because of a neck injury, and but this patient had attacked the security officer. And I wasn't supposed to, but I did. I jumped in, and everything was fine. We restrained the patient. And then, within a couple hours, my neck had tightened up, and my nerves and everything had deteriorated to a point where I couldn't even lift a soda can with my right arm, nor move a mouse on a computer. So I had a pretty severe injury that resulted as a result of a patient restraint issue. So, and it took me over a year to recover from that. So, not only do I address and help people get through incidents of workplace violence, but I also look at it from the perspective of also being a victim as well. So,
well, between your experience and all the experience of the people online here, I think we've got big numbers for sure. So
yeah, and that's the point I'm trying to make here, is that I'm just one guy, and we have maybe 25, 30 people online here, all with similar stories as mine. So that's how prevalent this issue is. It's global, and we'll talk about some things later on here in the presentation that kind of brings that point home with and what the regulations are trying to accomplish.
great. Well, let's go right there then. We did have a brief overview of what we're going to be covering today, so you'll see that here. But let's get started. We wanted to start with the definition of workplace violence. I know a lot of you already know this, but just so we're all on the same page, Bill, can you start there, and then we'll go into all the statistics that go with what you've got to share?
Yeah, everybody has a definition, and they hopefully you're putting it into your hospital's workplace violence policy. And this is the one from OSHA, so this is as good as any, and they all kind of say the same thing. We all know what workplace violence is, but where the rub is trying to explain it to healthcare administration and others, who don't deal with in our line of work, and how important it is to get resourcing to address this. So, but let's move on. Next slide here. Just kind of let's think about workplace violence from a history standpoint. So historically, back in the 1980s, some of you may not have been born then, but I was certainly in the workforce at the time. We thought about workplace violence originally as really just employee versus employee. It was strictly HR stuff. One employee was, harassing another, and they had to move the cubicles or whatever. And that's what it really started from way back when. Then the OSHA guidelines came out in 2004, and they've been upgraded since, but I think for healthcare, we knew that there was violence in hospitals, but we really didn't really, we just thought of it as part of the job. In 2010, the Joint Commission issued this Sentinel alert in June of 2010 is when this occurred. It was alert number 45. And this was really what I think was the turning point and brought a whole new perspective and shed a whole new light on workplace violence in our industry. Interestingly enough, the picture that you saw of me, that was at Danbury Hospital in Danbury, Connecticut, where I was working for about 20 years in security. I had left at this time. By this time, I was 5 years or so, 6 years or so into I became an attorney. And what happened at Danbury Hospital, my hospital, was a patient was brought into the emergency room through an ambulance entrance. Some psych history, but he was there for a cardiac issue. You know, he wasn't like a regular type of psych patient, the ones that we deal with on a regular basis. So nothing to alert anybody there. He gets admitted to the cardiac care unit. He's there for a couple of days, gets into an argument with his nurse and shoots the nurse with a handgun he had concealed under his Johnny coat for a couple of days. So if you can imagine that, that's what happened. Patient gets out of the room, and then the security team responded. And that was one of my squads too. So I'm very proud that they took on this shooter, and they tackled him. He did get another shot off. It went through the ceiling as they were wrestling around with the guy in the elevator lobby. And fortunately, nobody else was hurt except for that nurse there. So, and the nurse did survive. And the security guys were, they're heroes, really, when you think about it. That situation just kind of landed on them. But anyways, and the reason why I bring this to your attention is that Sentinel alert was due to that, and Danbury Hospital got fined quite a bit. They got fined max amount for not addressing workplace violence. The security program was a great security program back then. In fact, it's better then than a lot of the hospitals I see now. I go into a lot of hospitals as a security consultant, and even back then, that was they were so far ahead of what most people do. So that was kind of the irony of the whole situation, was that this is a great security program. We actually had a workplace violence policy way before anyone else, but it still wasn't enough at that time. It's the world had grown up a little bit around us at that time. But moving on, ASIS, SHRM created some guidelines. They became standards, and then so forth and so on. Yeah, you can see IHOS did a first survey on workplace violence victims, and then NFPA came out with their chapter, which is very good. So I would recommend, if you haven't looked at those, look at them, comply with them, and you'll have a pretty good security program. And then, of course, the Joint Commission's new, they're not standards, they're requirements. So, but we'll talk about those here in a minute. So let's move on. I think we've all seen this before. We know what the typology is, and the breakdown in hospitals is clearly type 2. Where an employee is victimized by a patient or visitor is clearly the number one thing that's happening in hospitals. So one point I want to make out is that workplace violence, it's not workplace violence if a patient attacks another patient, in theory. I mean, there's violence in the environment, but it's, an employee has to be involved for it to be a workplace incident. So well, let's move on here. Next slide. And I deliberately put this slide after, even though it kind of comes out of sequence a little bit. One thing I'll note is sometimes after a lot of critical incidents, there's a lot of knee-jerk reactions to decisions on security measures. And a lot of times I see hospital administrators trying to placate employee fear. So they'll throw a lot of dollars at security, and by implementing a shots fired system in your hospital, or halon dump at the triage in case somebody has a firearm and things like that. And I'm not saying by any means don't address active shooter, absolutely do. We need to prepare for these things. However, after a lot of critical incidents, that's when dollars all of a sudden start to appear. So the first thing I would say is make sure you have a plan on the shelf, always waiting for something like that to happen. Have a clear strategy beforehand, because you never know when that situation was going to present itself, and you want to be ready to strike. But the reason why I say make sure that you're, let's direct money at the problem. So the last slide we saw that clearly we're having nurses and security officers and hospital employees attacked on a daily basis, whether it's verbal or physical. That's a day-to-day thing. But the statistical probability of being killed by an active shooter is so remote. It's like getting struck by lightning, or winning the Powerball or something like that. And then a lot of us see the FBI report that comes out every year, and we look at it, and it's usually between 0 and 2 or 3 incidents that occur in a hospital. So it makes up about 2 to 4% of active shooter incidents. So think about that statistical probability, and then that's the total universe of active shooters. That's that probability there. But then in a hospital, it's only 2% of that number. So it's even that much more remote. And then we spread it out over, there's 6,100 hospitals in this country. And, if you have just 1 or 2 incidents a year, where is that clear and present danger? Where are you going to invest those dollars? Does it make sense to do those things first? I mean, if you've already implemented a lot of different security measures, then yes, it might make sense to implement something like that. But you really want to start focusing on what's going to address workplace violence in the here and now. So moving on, let's take a look at the impacts. We know about physical injuries, psychological PTSD, depression that results as a result of that. Interestingly enough, we haven't had a study come out since this 2016 American Hospital Association study that really measures the cost to healthcare. So we know in 2016, and I know we have a lot of healthcare security and administration folks on the line here. So we know that workplace violence has gone up dramatically since 2016. And in fact, this study was probably measuring 2013 through 2015. So so we can say that with some reasonable assurance that 2.7 billion is probably way higher than that. So the other thing is nurse retention. And I've been kind of on a nurse retention kick. So if you follow me on LinkedIn, that you know that I've been kind of pushing that the last week or two. Nurse retention, $50,000 to $90,000 per nurse to have that nurse replaced. So what we're seeing out there in hospitals, and the ones that I've been surveying here in the last couple of years, is about 3 nurses a year that are known to security directors or hospital administrators or HR directors. We know that 3 nurses a year are leaving on average. Some might be 0, some might be 6, so. But we know that nurses are leaving the job because of workplace violence. So think about that. So if you have 3 nurses leave your hospital in a year and it costs you $50,000 at the lowest, that's $150,000. So that's a dollar figure that you can use to your administration to advance your workplace violence program. But now I figured
a quick little poll we can ask.
Yeah. Let's do the poll. And among the folks here, and we know this is not going to be a scientific poll, but if you've had a nurse leave your organization in the last year because of workplace violence, go ahead and click yes. If you don't know, or if you don't think any nurse has left your organization, just go ahead and click no. And I kind of would love to see what the poll comes out here in about a minute.
Yeah, I'm just giving it a minute to responses to come in. It looks like we're pretty close to everybody responding.
And while we're talking about that, what I'll say is that take that 50,000 for a nurse leaving your organization and multiply that by 6,100 hospitals, and you will find that the cost is over $1 billion in nurse retention. So
So
amazing.
there are our results.
Wow, I'm actually surprised it's not higher.
Yeah, that's
So
more even than I would have expected as well.
okay, well, still, you know, that's pretty significant. When you're losing nurses, that's a big cost. And the other point I want to make about nurse retention rates is that why it's so important, it's not just a matter of replacing the nurse, it's the continuity of operations. So to sustain your hospital operations, you need clinical personnel. And in fact, I was in a hospital last year where they actually had to shut down a couple of units because they could not staff them with nurses. So you're losing all that revenue. And when you're losing that revenue, you can't operate your hospital as efficiently. So it's much deeper than just replacing the nurse. It's costing you money on the back end through not being able to offer those services. So, all right, let's kind of move on to the next slide here. And you know, a lot of this data is kind of dated. So, you know, you can see here in the slide to the right, many of you have already seen this. This is from the US Bureau of Labor Statistics. And this is the most recent data I could find on issues related to workplace violence. And really all we're trying to illustrate here is that healthcare has a disproportionately large ratio of workplace violence incidents compared to other industries. So, and the other trend lines, we're showing it going up. But we haven't had any real studies on this through the pandemic yet. So that, and I'm right up there on in the header, you know, the estimated increase of workplace violence in hospitals through the pandemic is 20 to 40%. And we can move on to the next slide here where it's going to say, now I got this 23% from the International Association for Healthcare Security and Safety crime poll for in 2021. The survey came back and it said 23% increase in workplace violence in the year of 2020. Well, we know the pandemic didn't end until 2022. So we don't know what the increase is in 21, but I will say that, you know, based upon what I'm seeing out there in all the hospitals, and when I go in and survey a hospital, I'll ask for their data if they have it, and everybody is going up. And I'll represent to you that it's probably another 15% up in 21. So add that to the 23%, and we're up around 40%. And that's where I kind of got that unscientific figure. And this is the chart for domestic terrorism. And the reason why I kind of added this in here is because if you look at this chart, if you look at the chart for mass shootings and you look at the chart for workplace violence, they all kind of follow that same trend line. And it's like everything started going crazy, you know, as soon as the pandemic hit. So it's violence has been moving up since then. So
So the
all right,
challenges get better, harder and harder every day on how
yeah,
how to meet this, how to manage
yeah,
this.
yeah, absolutely. And oh, we wanted to do another poll, didn't we? On
We could do them now.
yeah. I thought it would be kind of neat to see if kind of measure everybody's workplace violence in your facility. Has it increased or decreased since the end of the pandemic? And we'll call March 2022, even though we're still kind of still officially in it. But in your hospital, is your workplace violence increased, decreased, or stayed the same since about this time last year? And we'll just wait a minute for everybody to kind of hit that, answer the poll here.
Okay. I think we got pretty much everybody's answered.
All right. Well, I'm interested.
There we go.
Okay. All right. Increase. It still seems to be trending up, even though we have We have stayed the same at 48%, which is okay, I guess. I mean, you know, it's one incident of workplace violence is not good, but still, you know, we have to, this is our reality. But it still looks like it's trending upwards here because the increase is about 3/4, 75% higher than decrease. So I would think that we're probably as an industry still trending up if we wanted to use this as our non-scientific rationale on that. So, but thank you everybody for answering those questions. And finally, before we wrap up with this this part of the presentation, we'll talk about where workplace violence is occurring. This is from Cal OSHA in 2018-ish, you know, this came out in 2019, I believe. So no surprises here to this audience, I would imagine. So let's just keep moving on here. All right, so I think, you know, we'll start talking about what is a workplace violence program. And these are the OSHA guidelines from 2015. And these are followed by Joint Commission and DNV. So if you're a DNV hospital, don't think that you're immune. So you're not getting out of this. Everybody has the same guidelines to follow. So, and these are the 7 things that you need to have in your workplace violence program, not your security program, your workplace violence program. Okay, because they're actually 2 separate things, even though, and we'll kind of walk into that in a little bit. So you need a policy statement. It has to be clearly written. Okay. You need to have a threat assessment team. You need to do security analysis and a workplace violence assessment. So those are 2 assessments, 2 different things, 2 different assessments. Workplace violence, workplace hazard controls and prevention. That's your security department and your security measures, and then you have to have training and education, a way to report, investigate, follow up, and evaluate incidents and threats, and then record keeping, probably most important for us as security practitioners. So let's jump into the regulations here. The new Joint Commission, we'll call them requirements because there are no new standards. And did they change any of the OSHA guidelines? And the answer is no, absolutely not. These are not changed. You still need all of this stuff in your workplace violence program. So we'll move on to the next slide. So what did the Joint Commission, what are they hoping to do here with these new requirements, elements of performance, things of that nature that have changed? So what they're really looking to do is they're looking to force hospitals to provide a safer care environment by, one, I think this is the most important thing, holding leadership accountable for their workplace violence program. The next is codifying a multidisciplinary approach. And why is that important? Well, because that's workplace, we're security. If you're a security director, you might be in charge of the workplace violence program, but it still requires a multidisciplinary approach throughout your organization to accomplish true prevention and response measures, okay? We want a designated leader. You know, there's an old adage in the military, if there's more than 1 leader, then nobody's in charge. So that's what we want to do. We want to have a clearly defined leader in your organization because we know that 2 people acting in concert doesn't get it done. We clarify the program roles in workplace violence. The one thing I really liked is they define what training and education that you need, and what Joint Commission is really trying to do is they want to standardize hospital workplace violence programs across the country. So everybody will be on the same page. So that when they go in, they're going to look at all the 7 items that we just went over, and they're going to evaluate those 7 items. But and they're doing that by holding leadership accountable. So let's go to the next slide and kind of start through this. So this is that leadership element. This is the standard here. It's standard LD 03.01.01. So that's the leadership standards in the Joint Commission requirements. The element of performance is number 9, and this is what's new, or not really new. They added to it. So the hospital has a workplace violence program led by a designated individual and developed by a multidisciplinary team. Designated individual, I would want that to be somebody who is the best person to advance the program, and that has to be somebody who can say yes to resourcing. So if you're a lot of times, and I was a security director and manager for a couple different organizations, we know that we are not that person who can authorize hundreds of thousands of dollars for things that we need to do from a workplace violence. So that designated leader, that individual has to be like a chief operating officer, if not the CEO themselves. A multidisciplinary team, that's risk management, that's HR, that's security, that's clinical, that's leadership. Everybody has to have a piece of this in order for it to be effective. So, and then really, let's go on to the next slide and kind of break it down so a little bit further for what a leader is responsible for. So the administrator is really accountable for the entire program. And if you notice, these 7 items that they're accountable for, that's the whole program itself. That's the workplace violence program. So, and this presentation will be available to you, so don't feel like you have to take notes or photograph it or whatever you might be doing. So yeah, let's move on to the next slide. Okay, some of the best ways to approaches that you can do as a security leader or as a workplace violence practitioner is the first thing I would recommend is, if you're in a large organization or a mid-sized organization, rather, every organization should probably have some kind of a workplace violence committee. But it's not enough to have that committee just meet and talk about things that have happened. You got to have a clear agenda. And what I like to see is a steering committee. And that steering committee just be a group of senior executives led by or with this required membership here. You want an executive owner, probably the lead security person, the lead risk manager, the lead HR person, and then some subject matter experts and some clinical, ER, legal, and some other folks who could provide some support. And just that steering committee, you meet and you just say yes or no to different initiatives, and then you farm out all the work and all the research to different subcommittees, and they would need to come back every month or 3 months or however frequently the steering committee meets, and they would report back on what they're doing in terms of improving workplace violence measures. So what you want to do is, and when I say saboteurs, these are well-meaning folks in your organization. All right, some of them just might be tourists. They hear workplace violence and they just want to hear, well, what's going on around there? Who got beat up or whatever? That's what I mean by tourists. Then you have the venters. The folks that they might be someone like me, someone who's been a victim of workplace violence, and they want blood. They want to make sure that they want to make sure the organization is doing what they need to do. So maybe they're effective, but maybe they're not. If they start sidetracking and hijacking meetings, storytellers, you don't want them. You want people who are passionate, but not overly passionate, and then and make sure you're keeping out those people who have their own personal agendas. These are folks that are going to sidetrack your committee, and really what you want to do is you want to get this work done very effectively. Next slide. Oh yeah, and keep that committee to 12 members. you know, I've come into a couple organizations in the last couple of years. They either don't have enough people, or they have like 50 people on the workplace violence committee, and that's not going to get it done either. Okay, threat assessment. I know a lot of you folks are very well versed, and there is a standard in the International Association for Healthcare Security and Safety. If you follow that, you're going to be good. Okay, but just understand that threat assessment is it's not a science. It's really an art, and you have to do a lot of these types of investigations in order to get good at it. And when I say good, you're a person that's going to be listened to by your organization. You're trying to make a determination as to what is the probability of this person committing this threat or this act of violence, or following through with this threat, or whatever it might be. And then you want to create a safety plan around that. And then that safety plan is where you probably get into a lot of cost factors. So the decision making, the decisions you're going to make with regards to that particular threat do have some financial implications, as well as disrupting operations and things like that. So you want to be sure that you have like representation from risk management, HR, legal, and admin. This is a whole topic in and of itself. So we're not going to spend as much time as I would like to, but just know that this is a very, very important piece of workplace violence prevention and response. Okay, next slide. This one is the security standard, or the EOC standard. It really applies to security, or whoever is providing security in your organization. So this is the Environmental Care 2.0101, and based upon findings of your workplace analysis. You know, what they're telling you here is that you need to do an assessment, and you need to do one every year. And that's really become the industry standard. What a lot of folks tend to do is they perform one security assessment and they lump workplace violence in there. That's fine. And right now, I think if a surveyor would come into your organization, they'll probably be okay with it, as long as you're adequately covering workplace violence risks. I recommend doing two different assessments, because really, when you think about it, security is not workplace violence, nor is it the other way around. So I recommend doing two different types. And there's a lot of different rules out there. ASHRM, the ENA, Emergency Nurse Association, a lot of different groups have a lot of different toolkits out there. Minnesota Healthcare Organization also has a good tool. So, and I think all of those would be acceptable through either joint committee.
Bill, oh, there you are. Okay.
Oh yeah, yeah. I did a poll, did my own poll a couple of months ago on how many organizations have done a workplace violence program assessment through an independent consultant. And really, it's a best practice to have an independent consultant come in every 5 years and do a security assessment. But really, since workplace violence is starting to become a little bit more formalized, nothing surprising here. And this wasn't a scientific, and nor was the number of people who responded a very good indicator. But what we did find is 67% of the folks who responded said that they had a consultant come in the last 5 years and evaluate their security program, but only 25% have reviewed the workplace violence program since the new requirements came out. So they've only been out just over a year and a quarter. So, you know, not surprising, but clearly something you want to keep in the back of your head. Okay. Surveyors love to see that you've had a consultant come in and evaluate and help the program out. Okay, so again, we're back to security. This is another requirement here. And the hospital establishes processes for continuously monitoring and internally reporting in investigating workplace violence incidents. So what does this mean? So this is a way to evaluate security and investigate, report an incident. So I think probably let's go to the next slide. It kind of makes it easier to explain. Okay, so in your healthcare organization, there are 3 places where you get the best data for workplace violence. One is security, all right? We know that. We track disorderly threats, trespassing, issues with weapons, how many times the police are called. That's great raw data. And then risk management, they'll have some information around what is reported to them through their risk reporting systems. Nurses will type in things, and a lot of times it's stuff that security was never even aware of, so it happens. And then claims information, which may or may not be available to you, but it's important to know how many times a hospital has had a claim against them. There's a cost associated with lawsuits and things like that. And then HR, there's employee reports, injury reports, how much missed time. What we want to see is that there is a place to funnel all this information to. And what I recommend in my article is that you take security, risk, and HR, and everybody report once a month or once a quarter or however often the environment of care committee meets, or maybe your patient safety committee, or maybe you combine the two in your organization. Have a place where that goes to. So you report and you track, and that way the committee is getting it on the record. Okay, this is what's happening in our organization in terms of workplace violence. And from there needs to be a dissemination process that goes to administration through your quality assurance and process improvement team. A lot of hospitals call it QAPI, QAPI. We want to make sure the C-suite is getting at least an annual report on workplace violence, and also the board of directors. So that's how we would like to see our information flow. And there's a reason why we want to do it that way, but let's go to the next slide and we'll come back to this. So this is a security program, all right? Over to the left, you'll see there's really 5 elements to any security program, whether you're in a large healthcare system or whether your security program is in a small community access hospital with maybe 5 or 10 beds, and the security team is the guy who mows the lawn, you know? So whoever is in charge of security, all 5 of these elements must exist to some certain degree. And we won't go into a lot of detail because you folks are security folks and you kind of know. But overt security, these are the things that people see. Covert, I'm not talking about CIA stuff. I'm talking about these are the things that nobody sees, you know. But this is where a lot of the security, you know, the most effective part of your security program is really covert. Nobody sees it, you know. Your investigations team, your training, your threat assessment, your, you know, business continuity, analytics, and things like that. What everybody thinks of security when they think of security is, you know, the officer on the post. Do you have dogs, metal detectors? You know, these are the things that people associate with security. All right. Now, there's been a paradigm shift in healthcare security, at least since I've been around. And the reason why I bring this to your attention is because if you have been a security director in healthcare for maybe only the last 5-10 years, you have never known a time where you actually investigated things like loss prevention. You know, we used to do things like that, but now, and the reason why I say this, because I had my CEO ask me, hey, Bill, you know, how much of your time are you spending on workplace violence? You know, and I said, Eric, listen, I would say about 90% of my time is spent either investigating it, responding to it, or trying to console somebody who's been a victim of it. And I'm sure a lot of you kind of attest to that. So just know that there's a little bit more to that. And the reason why I bring that up is because loss prevention has become like a lost art in a way. And if your organization is losing 10% of its materials and you're spending about $400, almost $400 million a year on materials, and you're losing 10% of that, well, that's $400,000. You know, you probably want to. I mean, I'm sorry, for 40 million. That's why I went to law school, because they promised there'd be no math. So lawyers divide by 3. That's all they know. So moving on. The workplace violence program, and remember I was telling you about there's a difference? Okay, so think about this Venn diagram here. You see your healthcare organization, the next thing down, that's your workplace violence program. It's multidisciplinary. Everybody has a piece in this. But the workplace violence program in many ways is entirely reliant upon, well, not entirely, but a lot of the things it relies upon is the effectiveness of your security program. Now, everybody has a piece in security in your organization, or they should. You should have a culture of safety. But that security program also relies upon the security department. So this is us. This is the boots on the ground and the security administrators. We are the people that are mainly the main support hub for both the security program and the workplace violence program. So, and why is this important? Well, let's go to the next slide. Okay. So you're in your workplace violence committee meeting with your multidisciplinary team, and we're looking to solve workplace violence here as an organization. And what do? Everybody looks down the table at the security director and say, hey, you need to do all this stuff. We need to train our people. We need to get all these security measures in place, and we need to do whatever it is that we need to do, to prevent and respond to workplace violence. But in most organizations, the hospital security budget, 90% of it is really labor and salary. So now we have 10% of the security budget. We're trying to solve all the workplace violence woes with this small 10%, which is really dedicated to your uniforms and putting gas in the security vehicle and all of these other things that you're trying to fund in your security program. So when you're trying to, this is what I call the security conundrum, because people don't understand the difference between the workplace violence program being separate from the security program. So everybody's looking to us to solve the problem, but there's just no dollars to do it. So this is why it becomes so difficult for you as security leaders to get all this resourcing that you need in order to convince administration on how to at least mitigate or address workplace violence. So really, it comes down to a few things here. So next slide. All right, we're back on this slide. What I find, and I was this person, I would get all these security statistics and I would get my ducks in a row, and I'd go to meet the COO or the CFO, and I'd say, hey, this is what's going on in our hospital. We have X amount of threats. We're trespassing 40 people a day, whatever it is that, and they look at it and they say, yeah, that's great. And then I'd say, well, I figured it out, and this is how much time we're spending in security dealing with it. Okay, that's great. That's your job. What do you want from me? So the problem with security data is, it's good data, and it gives us a good idea of what's happening in the hospital without any question, but it's just raw data. It's not the data that you need. I mean, the outrage value of some incident that occurred, that only lasts so long, and the tug on the heartstrings approach, that's probably not effective to the CFO. These people have no soul, so they don't care. They're just trying to balance their ledger. Who knows? Anyways, so what you want to do is you want to make friends and I'm sure you already have with your risk manager and your HR director, okay? Because this is where you can get some real value-based data and then bring them to the meeting next time with when you're asking for workplace violence resources. So what the risk manager can bring, again, is they're going to have a whole different set of incidents than security, because a lot of incidents that get reported to you probably don't make it into a risk master report, and vice versa. So, and I found that to be true. Okay, so they're going to have a whole portion of data that you didn't have. So that's going to increase your numbers a little bit. But they're going to have information on claims and regulatory investigations and how much maybe they've paid out in lawsuits. This is a value-based data number that you can take to the CFO and say, hey, listen, we paid out $2 million a year in claims because of workplace violence or issues. Well, that'll raise a couple eyebrows. But I think the better source here is HR, employee relations, or employee health. Whoever in your organization keeps track of incidents of medical costs, injuries to staff, missed time, what the backfill cost for those folks who missed time is, workers' compensation claims. These are tangible numbers. These are things that you can point to, and you can say, all right, you can even take it a step further. We've had X amount of incidents occur in the last year, and this is the dollar figure. So it's costing us, $300 per incident or whatever, and then we're having 20,000 incidents, and kind of dress it up like that. So you want to go in there, you want to have value-based reporting to back up your arguments for more security and more workplace violence response and prevention measures. Okay, let's move on. So, I was asked, what's the price tag on workplace violence? What's the hardest thing that administrators are having a trouble with spending money on? And really it comes down to this: training. And this is where the HR folks, this is their standard. And what they're responsible for is keeping track of training. And the thing I like about this standard is it tells you exactly what and when you need to be trained. So in the highlighted version, at the time of hire, annually, and whenever somebody changes a job, they need to go through whatever the training is required for that specific role. So each job description should have a standard or a set training requirement that they need for that, because the security officer is obviously going to have probably the most amount of training, but somebody who is like a IT tech, and these folks have no contact whatsoever with the public. In fact, they prefer it that way. They like to sit behind their desk and type out things, and they never answer the phone. It's always by text. So moving on. No knock on the IT folks. They're great. They're a very necessary part of the operation. Okay. Next slide. Okay, so this is what you need. This is what I recommend. In my article, I go into a lot of detail about why you need every single one of these things and who should get this training. So I think to a certain degree, if you're looking through all this, you will probably agree that your organization provides most of this. I carve out threat management training here. I think the threat management team needs a little bit extra amount of training. I also recommend a special course for leadership to help so they can turn around and deal with their employees more effectively in terms of workplace violence. Okay, next slide. Yeah, so I was asked, all right, what can we expect here from the Joint Commission? And quite honestly, I'm not sure. Last year, I thought as soon as they implemented these processes, we would see them start drilling down on hospitals, but they didn't. I think a lot of that had to do with, we were still in the pandemic, and we were dealing with that till about June. And I actually sat in on a few surveys with clients of mine and got them ready for workplace violence. And I was really surprised that they didn't address it at all, hardly. But this year, I think it's going to be different. And if you notice this, if you saw this memo come out in November, late November of last year, it was probably related to a few things that happened in 2022. We had a pretty significant shooting incident at a hospital system in Tulsa, Oklahoma. We had a few incidents across the country, particularly in California and Ohio, where some nurses were stabbed. And unfortunately in Dallas, we had a couple of nurses killed in a nursery there. So right after that Dallas incident, this memo came out, and it's addressed from the CMS to state surveyors, and it said, hey, start looking at violence. This is a problem in hospitals. So I would love if somebody would contact me if you've been surveyed either by DNV or Joint Commission. Send me an email or something after that. Get on the phone. I'd love to hear your experience and see if the surveyors were, what they were asking you about in terms of workplace violence. So, okay. Well, that's about it for my presentation. Are there any questions out there that we would want to start answering?
There were questions about cost, and I think you kind of touched on that. And the who ultimately holds responsibility for getting this workplace violence program regulations met, which I believe you answered as well, but maybe you want to just address that again.
Yeah, so clearly one of the intent of the Joint Commission, I believe, and of course I can't say what they were thinking, but to me, the whole the totality of all of these upgrades in their elements of performance suggests to me that they are really starting to attach accountability. A lot of times I've seen hospitals just kind of like check off the boxes on their workplace violence program. Did we do this? Do we do that? Okay, but are we really addressing workplace violence? You know, and it's not that administrators don't. They want to. They're not mean, evil people that we as security folks think they are. They're actually pretty decent folks, and they really want to solve the problem. But a lot of times they just don't have the money to pay for it. And I think that particularly like when we come up with a training and education plan, and I've done this before, I said, okay, this is what I'd like in a perfect world, and it's going to cost $4 million to do this. So, well, that's probably not going to fly. So you have to be very creative in your ways of training, and don't think that this sits squarely on your shoulders. And it did for a while in a lot of organizations, and myself included. Workplace violence was a security problem to solve. So I really like that emphasis on multidisciplinary. It's really great when you can get like clinical educators and nurse leaders on your side and be part of the solution. And when they are part of the solution, it makes it a lot easier to get to yes with administration on these issues.
Okay. We have another question, Bill, here. What were the resources for security and workplace violence assessments?
The resources for assessments. Well, you know, that's something you do yourself. You know, you're a security director, either you or a trusted employee of yours can do the security assessment and the workplace violence. Oh, the resources for the workplace violence assessment. I know what you're talking about. Yeah, you can go through the Emergency Nurse Association, ASHRM, the American Society for Healthcare Risk Management. They have toolkits that will, and actual assessments that are pretty good. There was another one. I was working with a healthcare system in Minnesota last year, and they introduced me to the Minnesota Healthcare Association, and they had a very good tool. If you email me, I will send you some of this stuff. I have it, so I could send you those.
Carol, I hope that answered your question, but I'm going to put up, well, here, I'll go. The Bill's email is right here. Where's your email, Bill?
Oh, I don't know.
The website's there, but you didn't put your email there. Anyway, she said thank you, so I think we answered her question, but we will be sure to email you those specific resources. If that would be helpful, we can email. We're going to email everybody this presentation, so, and you'll be able to get access to the recording as well if you needed to listen again, or if you wanted to share this with any of your other team members. So I just wanted to give you a heads up. We'll be doing 2 more of these events, one on educating your C-suite to the security budget needs, and that's going to be in May, the 24th. We'll be sending you emails about that. And then the last one we'll be doing is in June, and it will be about visitor management practices and moving forward from COVID. So we've got 2 more opportunities to have these conversations coming up. We thank you, Bill, for being here today and joining us. And I thank all of you for taking the time out to join us. And as I said, there's 2 handouts on the platform now that you should be able to access. One is this PowerPoint presentation. The other is the article that Bill mentioned earlier specifically about the Joint Commission and the new regs for workplace violence. So those are both handouts here. My email is here, maclerkin at thresholdsecurity.com. So I can send you whatever you might need as well. So please feel free to reach out to us so we can help you, and we will follow up with you on as well. So thank you all for joining us. If there's no more questions, I don't see any more, we're going to call it a day and head out for lunch. So thanks again, everybody. Bill, thank you. Did you have anything else you wanted to add before we closed up?
Yeah, no, like I said, you can go to the website there. There's a couple of links that you can click for contact us or contact me, and just put your information in and I'll send you those articles. But I just really want to thank everybody. It shows that you're really interested in being part of the solution for workplace violence. It's a real challenge for all of us, and I really think we're starting to develop methods to address that. So, and that's really what the Joint Commission requirements are all about.
Great. All right. Thank you, everybody. Have a great day and a great weekend.